Hi there. My name is Dr. Amy Pearson, and I'm a fellow in pain medicine at the Mayo Clinic.
And I'm Dr. Rajat Moman, resident in anesthesiology at the Mayo Clinic. We are co-authors for the article entitled Provider Confidence in Opioid Prescribing and Chronic Pain Management, Results of the Opioid Therapy Provider Survey, published with Dr. W. Michael Hooton, Dr. Jason Eldridge, and Dr. Susan Moeschler, also of the Mayo Clinic, in the Journal of Pain Research.
Many providers report lack of confidence in managing patients with chronic pain. Thus, the primary aim of this study was to investigate the associations of provider confidence in managing chronic pain with their practice behaviors and demographics.
The primary outcome measure was the results of the Opioid Therapy Provider Survey, which was administered to clinicians attending a pain-focused continuing medical education conference.
We found that women comprised 55% of respondents, 92.8% were white, and 56.5% were physicians. Primary care providers accounted for 56.5% of the total respondents. Most providers, 57.9%, had previous additional post-training education in pain management, although only 34.8% had a state requirement for opioid-related continuing medical education.
The majority of respondents, 60.8%, did not feel confident managing patients with chronic pain. Provider confidence in managing chronic pain was positively correlated with following an opioid therapy protocol, a perceived ability to identify patients at risk for opioid misuse, and using a consistent practice-based approach to improve their comfort level with prescribing opioids. Provider confidence was negatively correlated with the perception that treating pain patients was, quote, a problem in my practice. Interestingly, there was no correlation of confidence with demographic factors such as sex, age, provider type, years in practice, state CME requirement, or additional training in pain management.
In this study, the majority of providers did not feel confident managing chronic pain. However, provider confidence was associated with a protocolized and consistent practice-based approach toward managing opioids and the perceived ability to identify patients at risk of opioid misuse. We hope that future studies investigate whether provider confidence is associated with measurable competence in managing chronic pain and explore approaches to enhance appropriate levels of confidence in caring for patients with chronic pain.
From those of us at the Mayo Clinic, we thank you for watching and participating with us in this important discussion.